Good day. I'm Carlo Detalla, and today I'm gonna discuss you about infection control. The unique nature of dental procedures, instrumentation, and patient care settings require specific strategies directed to the prevention of transmission of diseases among dental healthcare workers and their patients. Disease transmission. Infections are spread if the following criteria are satisfied. First, the presence of a susceptible host. The second, the presence of a pathogenic microorganisms. And lastly, portal of entry via which the organisms invade and colonize the susceptible host. Medical history. A thorough medical history should be taken and updated, essential in alerting the clinician to medical problems that could, in conjunction with dental treatment, adversely affect the patient. There are four types of protective measures. First is the immunization, second, protective coverings, third, sharp instruments and needles, and lastly, first aid and inoculation. We will discuss individually these protective measures later. Immunization. All dental healthcare workers are advised to be immunized against HBV unless immunity from natural infection or previous immunization had been documented. Protective covering. The types of protective covering are uniforms, hand protections, protective glasses, masks or face shields, sharp instruments and needles, and first aid and inoculation injuries. Uniforms. Uniforms should be changed regularly and whenever soiled. Gowns or aprons should be worn during procedures that are likely cause spattering or splashing of blood. Hand protection. Gloves must be worn for procedures involving contact with blood, saliva, or mucous membrane. A new pair of gloves should be used for each patient. Hands should be washed thoroughly with a proprietary disinfectant liquid soap prior to and immediately after the use of gloves. Disposable paper towels are recommended for drying of hands. Any cuts or abrasions in the hands or wrist should be covered with adhesive waterproof dressings at all times. Protective glasses, masks, or face shields. Protective glasses, masks, or face shields should be worn by operators and close support dental surgery assistants to protect their eyes against spatter and aerosols which may occur during the cavity preparation, scaling, and cleaning of instruments. Sharp instruments and needles. Sharp instruments and needle should be handled with great care to prevent unintentional injury. Needles should never be recapped by using both hands in direct contact or by any other technique that involves moving the point of a used needle towards any part of the body, so you should always be careful when handling needles. The needle can be recapped by laying the cap on the tray, placing the cap in a resheathing device, or holding the cap with forceps before guiding the needle into the cap. First aid in inoculation injuries. In the event of a skin puncture by a contaminated instrument, the wound should be encouraged to bleed and washed thoroughly with running water. All incidents should be reported to the officer in charge of the clinic, where there is a reason to be concerned about the possible transmission of infection. Advice on appropriate serologic testing, medical evaluation, and follow-up could be sought from Accident and Emergency Department or AIDS unit, and the address and contact telephone of the patient concerned should be recorded. Instrument sterilization. All instruments should be cleaned thoroughly before sterilization by rinsing and scrubbing with detergent and water. Splashing of water should be avoided. Heavy-duty gloves Where appropriate, face protection shield should be worn. Items which will penetrate tissues must be sterilized in an autoclave or hot air sterilizer. Items which will not touch mucous membrane but not penetrate tissues should similarly be sterilized by heat or, if not possible, disinfected. Handpieces, ultrasonic scaler, inserts or tips, and air-water syringe tips where detachable should be flushed for 30 seconds, dismantled, cleaned, oiled where required, and autoclave between patients. Following sterilization, all instruments should be stored in clean containers to prevent recontamination. Surgical and endodontic instruments should be kept in closed containers. It may be necessary to sterilize them immediately before they are used, and care should be taken to ensure the instruments are cool prior to use. Surface disinfection. Surfaces that are likely to become contaminated by and may be decontaminated, and after treatment are protected with disposable coverings before they become contaminated. Effective cross-infection control is aided by a strict system of zoning and the use of sterilizable trays. Procedures should be adopted which limit the areas touched and contaminated each time a patient is treated. Between clinical sessions, work surfaces should be thoroughly cleaned and decontaminated with ethyl alcohol 70% if there is a visible blood or pus. The surface should be cleaned and disinfected with sodium hypochlorite 0.5%, followed by water rinse. Protective gloves should be worn in care taken to minimize direct skin, mucosal, or eye contact with this disinfectant. Aspiration and ventilation. The use of high-volume aspiration will reduce the risk of cross-infection from aerosols. The risk is further reduced by good ventilation. The tubings of high-volume aspirators and saliva ejectors should be flushed with water between patients and with disinfectant, sodium hypochlorite 0.1%, regularly or according to the manufacturer's instruction. Disposal of waste. Sharp items including needles and scalpels and local anesthetic cartridges should be placed into puncture-proof containers which should be securely sealed. This, together with all medical waste, must be disposed in red bags, securely fastened, and red plastic bags are to be picked up by special collection service for hospitals and clinics. Non-infective waste should be disposed of in thick black plastic bags, securely fastened. Liquid waste should be carefully poured into a drain and then flushed with water. Spatter and splash should be avoided.